Welcome back to another segment of ACRPtv. My name is Michael Causey. I'm the editor-in-chief here. Our spotlight today on the regulatory review and the 2021 crystal ball. And we've got the right guy with us for this segment, Patrick Cooney, who's the president of the federal group, knows all, will tell some. Patrick, so good to have you join us today. I really appreciate your time.
Michael, thank you. Really appreciate it. Happy to do it.
Let's jump right in and talk about, the big thing in this year, looking at kind of the year in review, and it's still going on, is the congressional response financially and otherwise to COVID vis-a-vis clinical trials. If you can, give us a little bit of the lay of the land right now, what's going on?
Yeah, no, happy to. It's hard to believe, as we sit here in October, I think back to earlier in the year, actually, Jim Cremidas, executive director of ACRP, and I were up on Capitol Hill back on March 12th. And
I remember.
Hard to believe.
I remember that day, yeah.
Because the very next day, basically they shut down the Capitol, and it's been not vacant. Certainly there have been legislators there, but not a lot of people up on the Hill these days. Everyone's working remote, as we are. But at that time, Jim was up on the Hill, and we were talking to congressional staffers about clinical competency in research. And it's interesting how much how the discussion has really shifted over the last several months and been so very much focused on COVID relief. And so you're right, there has been a lot going on COVID relief. We've certainly been monitoring a lot of the legislation. There's been a number of bills that have passed through Congress. Probably the primary one that people know of is the CARES Act. The CARES Act provided about $2.2 trillion in funding to a variety of areas, including healthcare providers, but also to small businesses through forgivable loans through the Small Business Administration, which I know have been helpful to so many businesses, and hopefully those in the clinical research area have taken advantage of those small business loans as well. So at the beginning of the COVID relief effort, there was essentially 4 bills that passed, the largest of which was the CARES Act, all very bipartisan. And that was through the month of April. And then since April, it's just been a difficult slog. Congress has not been able to pass additional COVID relief legislation. A variety of reasons for that. Disagreement over some of the things that were passed in the CARES Act. For example, the amount of unemployment compensation. After they passed it, it was immediately an issue of controversy, and it has slowed down. That and several other issues have really slowed down progress on further relief. Although the House has passed a couple of different bills, the Senate has really struggled to pass legislation. And so where we sit now is that it looks like negotiations between the White House and Congress are stalled at this point. We're probably not going to see additional COVID relief until probably after the November elections.
And as you know, clinical trial sites, many of them have been really struggling during this time, both public and private. What's the likelihood of public and private sites? I know there's 2 very different animals from a regulatory standpoint. What's the likelihood of them getting any kind of financial relief and support, in the months ahead?
Yeah, that's a great question. And the good news is there has been a bit of work focused in this area. There have been 2 bills introduced in Congress. The bills are identical in the House and Senate. It's called the Research Investment to Secure the Economy. One bill introduced in the House of Representatives by Congresswoman Diane DeGette, Democrat from Colorado. Another bill introduced in the Senate by Senator Ed Markey, Democrat from the state of Massachusetts. Now the Senate bill, he's joined with Senator Tom Tillis, Republican from North Carolina. And that legislation has actually been moving its way through the committee process. It was taken up in what's called the Senate Commerce Committee just really recently in mid-September. That bill passed out of committee, and we've been working with some other organizations to try to affect that bill, because one downside to the bill, and I should say what it provides, is about $25 billion in possible relief funds to institutions that are doing clinical research. And this includes stipends for personnel, but it also covers equipment costs and the types of modifications that need to be made, to make sure that these labs and facilities are safe during this period. So resources that are really critical. Now, of that 25 billion, about 10 billion of it is earmarked for clinical research through NIH. Of that 10 billion, we have been making the case that not only should public clinical trial sites have access to these resources, but certainly private sites as well, and have been working with all of the sponsors of the legislation to modify the legislation. So the good news is we have gotten agreement from all the sponsors of the legislation, and are now working with some of the other key stakeholders. But we've got an agreement to include language that would cover private sites, because that's been the real deficiency in the bill to this point. The next opportunity to amend the bill will be when it comes to the floor of the Senate. I'm guessing as part of a COVID-19 package for relief, probably after the election. But we're working right now to just get all the commitments in place so that private sites can be included in this legislation and receive some portion of that $10 billion in funding that would go to NIH. So remain hopeful and optimistic about it.
Yeah, well, sites certainly need the help, many of them, and deserve it. I know this is a hard time right now. I mean, we're in a state of flux. We have an election coming up. The Senate may flip parties. Presidency may change. A lot of things are liable to change in the next few weeks. Having said that, what do you see sort of in the regulatory crystal ball for 2021 in regards to clinical trial regulations?
Yeah, well, specific to legislation, I think there is an opportunity in the new Congress, whether it doesn't so much matter which political party or which administration's in place, because clinical research should be apolitical. It should be bipartisan, and so that's kind of the way we look at it. Is we work with both sides of the aisle just to promote clinical competency in research. And so I think there will be an opportunity in the new Congress to address that issue of clinical competency, and something that that the association has been really striving for in this last year. Interesting, at the end of last year, in the end of 2019, ACRP was able to get some important language attached to an appropriations bill that funds NIH. And that language called upon NIH to do more to ensure clinical competency of clinical research professionals. And so I think had COVID not happened, our hope was to kind of further that in this 2020, but things being as they are, that is our goal for 2021, is to really kind of take what we've done already on clinical competency and kind of take it to its next step. Now, the possibilities there are either legislation or continuing to work with NIH and other federal agencies on guidance that would instruct those doing clinical research to ensure that their personnel were competent.
Certainly room for optimism. I want to thank you very much, Patrick Cooney, the president of the federal group, for joining us today on our ACRP TV Spotlight Regulatory Review in the 2021 Crystal Ball. Patrick, thanks again for joining us.
Thanks for having me. Really appreciate it, Michael.